SDS Medical is proud to introduce healthcare's most innovative patient transfer product for semi-ambulatory patients. The patented SDS Transfer Vest is the long-awaited solution for safely transferring semi-ambulatory patients and loved ones while significantly reducing the risk of injury to caregivers. The groundbreaking design offers comfort and safety to the process of moving people and patients in a more dignified manner. This video will show you step-by-step how to help transfer patients and loved ones with safety, dignity, and security. We will show you both one- and two-person transfers. It is very important to remember this product is for semi-ambulatory patients, which means they can partially bear weight, yet require assistance from one or two people. First, to ensure that you order the appropriate size, the patient's body cavity should be measured approximately 1 inch above the navel around the entire body. We currently offer two sizes, a small medium which measures 28 inches to 35 inches, and a large X-large which measures 36 inches to 44 inches. We're also very excited to release the Carson Leslie pediatric line, which will measure 20 to 27 inches. We're also in the prototype stage with a XXL size measuring 45 to 52 inches. To learn more about our complete line of products, we encourage you to visit our website at choosethevest.com. The SDS Transfer Vest is so easy to use, anyone should be able to help someone put on and take off the vest in a minute or less. This is especially critical in healthcare settings, because if it were too difficult or time-consuming, employees will typically attempt to manually transfer the patient. The vest is easily placed over the head with our poncho-style design, which is especially helpful if the patient has any upper mobility issues. If the product is being utilized for multi-patient use, you will first place the non-permeable disposable liner over the patient's head, followed by the vest. The front of the vest should lie flat, just below the chest or breast area. First, pull the left flap toward the front and side and use the Velcro to secure it snugly. Then pull the right flap toward the front and side, making sure the vest fits snug yet comfortable. Next, secure the laminated gait belt at the waist, snug and secure without discomfort. This will prevent the vest from slipping up or down after ambulation. Keep in mind that the vest is not intended to be worn for an extended period of time. We are excited to unveil our newest innovation, the glute strap, which truly changes the entire landscape for patient transfers. The clavicle handles are supported by an internal webbing design, dispersing energy vertically down to the two ladder locks, then through the glute strap, which initiates the transfer from the buttocks. So when you pull on the clavicle handles, you are directly pulling from the buttocks, which also keeps the vest from riding up during ambulation. Once the patient is in a standing position, the glute strap should easily slide off the buttocks, and then you use the shoulder or waist belt handles to stabilize the patient's upper torso. If you are transferring someone from one sitting position to another, say from a bed to a chair, the glute strap should remain in place. Here's how to secure the glute strap to the ladder locks. First, one side of the glute strap should already be fastened to one ladder lock. If not, follow these simple steps. First, slide one end of the glute strap upward through the closest of the two rectangular slots on the ladder lock. Then bend the strap face down to slide it through the other slot. Once secured, the end of the glute strap should face outward or away from the vest, while the part of the strap that goes around the buttocks faces inward toward the vest. With the patient in a sitting position, simply cue the patient to lean forward and gently slide the glute strap along the middle of the buttocks at a 90-degree angle. Keep in mind, since you will be transferring the resident using a forward and upward motion, the glute strap does not have to be placed entirely under the buttocks and legs. Once the glute strap is positioned around the buttocks, secure this end of the glute strap as you did the first, sliding it upward and through the nearest rectangular slot to the vest, folding over and then pulling the strap down through the other rectangular slot. Again, both ends of the glute strap should be facing outward. Now, simply pull down on both sides of the glute strap to take out any remaining slack to ensure the vest does not ride up during the transfer. Once the vest and glute strap have been secured, properly align the patient's feet, shoulder width apart. We also advise encouraging the patient to grab onto your arms, as this will make them feel more secure. To reduce your risk of injury, use proper body mechanics and weight distribution. Place one foot between the patient's feet, aligning your knee between the patient's knees. Your other foot should be approximately 2 to 3 feet directly behind you. In a one-patient transfer, before grabbing both clavicle handles, make sure you bend your knees and keep your back straight at all times. Now, grab the handles located at the clavicle area to begin pulling the patient towards you and upward at a 90-degree angle. Remember, it is much easier to begin the transfer by pulling the patient towards you rather than vertically, which will also relieve stress to your back and shoulders. As you pull the patient towards you, you should begin to shift your weight from your front leg to your back leg, using a rocking motion during the transfer. This rocking motion is critical for using your lower body strength, which will reduce your risk of back or shoulder injury. Also, by pulling the patient towards you, you are aligning the buttocks and torso directly over the feet to stabilize the entire body once they are standing. Once the patient is ambulated, the handles located in the back at the shoulders, as well as those on the waist belt, can be used to stabilize the upper torso if the patient is at risk for falling after ambulation. If you are transferring from one sitting position to another, put one foot approximately 2 to 3 feet in front of the other, keeping your back straight and legs bent. Pull and rock patient forward and upward while you transfer weight from front leg to back. Cue patient to pivot the feet to align with the final transfer point. Shift your weight from back leg to front leg using a rocking motion. Again, keeping back straight and bending your knees while lowering the patient safely and securely to the new seated position. For a two-person transfer, each caregiver will be on each side of the patient. Each will grab a clavicle handle with the front hand, as well as a handle located on the waist strap with the back hand. Cue the patient to move forward and up, while each caregiver keeps their back straight and knees bent. Both caregivers will use a 90-degree stance to rock the patient forward and upward out of the seated position into a standing position. Pull the patient forward so the upper torso is directly over the feet. If the transfer is to another sitting position, once the patient is upright, ask the patient to help pivot the feet to complete the transfer. The patented SDS Transfer Vest is the long-awaited solution to safely transferring semi-ambulatory patients and loved ones while significantly reducing the risk of back and shoulder injuries to the caregiver. For more information, please visit our website at choosethevest.com. Our passion at SDS Medical is to continue to develop and bring innovative products to the forefront. Let us know how we can help you.